Hypertension is a serious medical condition and is a leading cause of death around the world.
Research shows that people with pre-existing conditions such as hypertension are at a higher risk of complications from COVID-19. Managing hypertension would require that people living with the condition find a way to maintain normal blood pressure during this time.
Right, joining us now on Skype is the Senior Medical Director, Solomon Jaden Medical Center, Dr. Akin Oyejoku. It's nice to have you, Dr. Oyejoku, for your time on the program. Really, when it comes to issues of hypertension, can you break it down for us? What really is responsible for a hypertensive situation?
Hypertension as a disease is something that is quite common in every society, and so many things are responsible. Medically, we see hypertension as both essential and non-essential hypertension, secondary or primary hypertension. As we get older, as everybody gets older, our blood pressure tends to go higher, and we could come down with hypertension. You see, you could also have diseases such as renal, heart disease, kidney disease, liver disease that could lead to hypertension. So obesity, there are so many things that cause hypertension.
Now, in this case, it is said that anyone who has hypertension is prone to being affected by COVID-19. How is that? Could you explain better, make us better understand how this makes people having hypertension prone to contracting the virus?
Contrary to what a lot of people are saying, actually, if you look well into the studies, people who are hypertensive are not actually prone to COVID-19. So there is no cause for panic. What they are trying to say is this: if you have any other disease, such as hypertension, diabetes, obesity, asthma, and you have not taken good care of it, if such a person come in contact with COVID-19, the result could be dire. Apart from that, if somebody is hypertensive and is taking good care of their hypertension, that is, he's taking his drugs as at when due, and the blood pressure is well regulated, then there is no cause for panic. COVID-19 is a disease that can affect anybody. It affects everybody, all ages, all races, and there's no discrimination. So there's no cause for panic for those who are hypertensive. No, that is not what we see clinically.
All right, make us understand how best to manage for those who already have it or who are prone to have it. Talk to us how to best manage it.
For those who already have hypertension, I think the best thing to do is to live a healthy lifestyle. First of all, like we say all the time, prevention, prevention, prevention. Stay away from situations that can expose you to COVID-19, and then take care of your hypertension. The government is doing a lot to make sure that people are safe, and but then it still rests on each individual to wear your mask, stay away from crowded places, and then you have to take your medication as at when due. Check your blood pressure all the time so that you know if your blood pressure is rising above normal. Hypertension is something that destroys the body over time. It's a chronic disease. It's something that stays in the body for a long time, and it has to be managed. But when hypertension is well managed, there is no problem at all. If the blood pressure is well taken care of course, there is no problem.
Now, we found out that initially this situation of hypertension was found amongst the elderly, so to speak. And these days, we're finding among young people who are perhaps ranging it from the age of 13 to 40. What really is at the heart of this?
Like I was trying to say at the beginning, we have basically two classes of hypertension: essential hypertension and then the non-essential hypertension. When we say essential hypertension, that is the hypertension we find mostly among elderly. As we grow older and as the body gets older, you come down with that kind of hypertension. It comes in gradually. Then you talk about the non-essential hypertension or secondary hypertension. These are this is the type of hypertension that is caused by an underlying disease, kidney disease, liver disease, heart disease. And now what we see in our society now is a lot of people coming down with kidney diseases, especially. And then we see a lot of drug abuse and other things. Another thing that has been on in our society for a while and we've not paid adequate attention to is the abuse of herbs. And somehow because of the cultural correlation between these herbs and our lifestyle, we don't want to talk about it. But the truth of the matter is that these herbs are destroying people. These herbs are destroying kidneys. So sooner or later, the more we check, the more we find younger people coming down with hypertension.
All right, now, besides hypertension, we understand there is also hypotension. Can you make us understand these differences?
Okay. Hypertension is the situation where the person's blood pressure is higher than what is normal for the age, sex, race of that person. Hypotension, on the other hand, is a situation where the person's blood pressure is lower than what is expected for the age, for the sex, for the race of this person. Now, just like hypertension, hypotension is something that we also have to look into. Hypotension, in fact, clinically is more dangerous than hypertension in the sense that it comes in insidiously and then the person may just collapse. And if misdiagnosed, if nothing is done on time, it could be fatal. So hypotension is when the blood pressure goes below what is required for the heart to be able to pump blood to all the vital organs or the tissues of the body, basically.
Now, in the management of hypertension, beyond the use of drugs, how much does our feeding and lifestyle contribute to its management or otherwise?
Thank you very much. In the management of hypertension, we have the medical, the pharmacological and non-pharmacological management of hypertension, and both are equally important. Feeding and lifestyle adjustments are very, very important. When we talk about feeding, we look at what we eat and what we do not, what we should not eat if we are hypertensive. As you know, hypertension is very common in almost every society. So for those who are hypertensive, usually we tell them, please eat or have a low salt diet, low salt, low fat diet. Also, we encourage active lifestyle. Sedentary lifestyle, as we know, has contributed a lot to obesity, syndrome X, and eventually hypertension. Also, if you look at our society these days, we sit down more of the time. We sit down at home to watch TV, we sit down in our car to get to work, we sit down at work, and we sit down in our car to get back home. So we encourage exercise. According to research, exercise of at least 30 to 45 minutes every other day is good for our heart, and it will really help our hypertension. Another thing is stress. Our society nowadays is filled with stress. We may not be able to avoid stress in our daily activity, but then we can manage stress. One thing is this: a lot of people take things too serious. I think we should know that our health is also as important as our work. As a matter of fact, our health is as important as our success. One of the reasons we have people dying in their 50s, 60s, when they are supposed to be enjoying their handiwork is because a lot of people just go after their ambition, go after the money, and forget about the health. But without good health, you cannot enjoy the results of all your labor. So, taking health seriously, looking for ways of countering stress, trying to live a stress-free life is very important. One way of countering stress is practicing yoga. Um, it's not very common in our society, but it's something we should practice. Trying to calm down and work on our stress. So
All right.
working on our stress level really helps with hypertension.
All right, it's really interesting to know. But however, yoga is gradually is becoming popular by the day when it comes to people who are practicing it, and is really helping people from what we hear. Now, talk to us. You mentioned diet earlier on. If we have to go into the specifics of what kinds of food should one take to prevent or manage, can you list that out so that people who are following a lot can really have a grasp of some of these foods?
Okay. In the Nigerian context, looking at what we have available, the traditional Nigerian society, we take vegetables and fruits as desserts. We don't take them as meals. And this has contributed to us taking a lot of carbohydrate and a lot of salt. So first of all, I would say avoid processed foods. Avoid canned foods, not just because you can afford it. Don't go after all this processed food. Some of these food already contain a lot of salt. And if you are hypertensive or you're trying to avoid hypertension, we don't want you to take too much salt. Too much salt is the enemy of the body. Also, too much fat, too much processed fat is the enemy of the body. So avoid those things. We want you to take a lot of fruits. If possible, take these fruits and vegetables as meals. When I say vegetable now, I do not mean, because there's a misconception when you say vegetable in Nigeria, people think of vegetable soup, like oha, edikaikon, and the likes. What I mean when I say vegetable is things like cabbage, cucumber, things like that. Take these things as meals. So they help to bring down the tendency of the body to have hypertension and all the other diseases. Right. In fact, as a matter of fact, you get a lot of vitamins from these vegetables. So if you can inculcate vegetable into the diet of the house, maybe one of the major meals is a vegetable meal or a fruit meal, I think it will go a long way in preventing and managing hypertension.
Now, at what point does hypertension lead to stroke?
Thank you very much. That is a very important question because nowadays we see a lot of people coming down with stroke in our society, and there's a lot of superstitions saying it's a spiritual attack or bad and all those things. When the blood pressure is not controlled and it rises too high, then you can have stroke. But that is not the only cause of stroke. When you have hypertension and you have some other diseases, such as sickle cell disease, diabetes, renal diseases, hypercoagulability state, that is those diseases that makes the blood too thick, then you can come down with stroke. So usually what we advise is this. Like in the case of COVID-19, I said earlier that people who have hypertension and they manage it well are usually not at risk of contracting COVID-19 than other people, and they are also not at risk of having a severe form of COVID-19 than other people, but as long as their hypertension is well managed. The problem is this: people have hypertension, they don't know they have hypertension, and they don't manage it well, or they know they have hypertension, they are not taking the medications well, or they have hypertension and some comorbidities. Usually the commonest is diabetes. When people have diabetes, the chances that they are going to come down with stroke if they are hypertensive is way higher. So what we say is this: if you have hypertension, if you have diabetes, you have to take care of it. You have to manage your blood sugar to be within normal limits. You have to manage your blood pressure to be within normal limits. When the blood pressure, even when you manage the blood pressure, for instance, and you do not manage the blood sugar, you can still come down with stroke. Wow. So that is one point you have to take into cognizance, because diabetes alone can lead you towards stroke.
All right, so we have to leave the conversation here now. Senior Medical Director, Solomon JD Medical Center, Dr. Akin Oyejuku, thank you for your time on the Breakfast Show.